Hi everyone, in this video we will talk about diphtheria according to Australian guidelines. So diphtheria is an acute illness caused by the bacterium Corynebacterium diphtheriae. Infection with this bacteria can cause or produce a thick membrane in the pharynx, which causes a severe respiratory obstruction. The bacteria produce a toxin that can cause life-threatening heart failure and paralysis. So, who should take the vaccine? The vaccine is recommended for routine vaccination in infants, children, and adolescents. It is also recommended as routine booster in adults, including those in special risk groups, such as laboratory workers, travelers to countries where health services are difficult to access, as well as vaccination of people who have missed doses of diphtheria-containing vaccine. So, how can we be vaccinated against diphtheria? Diphtheria-containing vaccines are only available in Australia as combination vaccines that include other antigens, such as pertussis and tetanus. It is recommended for children at 2, 4, 6, 18 months, and 4 years of age, and adolescents at 11 to 13 years of age. It is also recommended for adults who are 50 years or older and at 65 years or older if the last dose was more than 10 years ago. Women who are pregnant or breastfeeding are recommended to receive a single dose of DTPA vaccine in each pregnancy. The vaccination is also recommended for travelers to countries where health services are difficult to access, every 10 years or every 5 years if they travel to some areas where there is a higher risk of acquiring diphtheria. Laboratory workers who may be exposed to toxigenic Corynebacterium diphtheriae in their jobs are recommended to have a serology test for diphtheria antibodies every 10 years. If the diphtheric toxin level is below 0.1 international unit per ml, then they should receive a booster dose of either DTPA or DT vaccines. As for adolescents and adults who have never had a diphtheria-containing vaccine, they are recommended to receive 3 doses of diphtheria-containing vaccine, which are at least 4 weeks apart, and booster doses at 10 and 20 years after the primary course. Although diphtheria is rare in Australia, it remains endemic in many developing countries. That is why we should take the vaccine. The only absolute contraindications to diphtheria-containing vaccines are anaphylaxis after a previous dose of any diphtheria-containing vaccine, and anaphylaxis after any component of a diphtheria-containing vaccine. Now moving on to the adverse events, Mild discomfort or pain at the injection site is common after receiving diphtheria-containing vaccine. This can last for a few days. Uncommon general adverse events after receiving DT vaccine include headache, lethargy, myalgia, malaise, and fever. Very rare adverse events after receiving DT vaccine include anaphylaxis, urticaria, and peripheral neuropathy. Brachial neuritis may occur after receiving diphtheria-containing vaccine, which is an inflammation of a nerve in the arm, causing weakness or numbness. The excess risk is approximately 0.5 to 1 in 100,000 doses in adults. Specific adverse events after receiving a combination vaccine, the DTPA, are extensive limb swelling, febrile convulsions, and hypotonic hyperresponsive episodes. The adverse reactions are similar whether a person receives the vaccine shortly after or at a longer interval after a previous DT vaccine. As for the nature of the disease, the Corynebacterium diphtheriae is gram-positive, non-spore-forming, and a non-capsulate bacteria. It produces an exotoxin that acts locally on the mucous membranes of the respiratory tract, or less commonly on damaged skin. It produces an adherent pseudomembrane. It can also act systemically on cells of the myocardium, nervous system, and adrenals. The incubation period is 2 to 5 days. The disease is communicable for up to 4 weeks, but carriers may shed organisms for longer. Diphtheria spreads by aerosol transmission, direct contact with skin lesions, and direct contact with items soiled by infected people. As for the clinical features, diphtheria can involve almost any mucous membrane. Pharyngeal diphtheria is by far the most common form of the disease in unimmunized people. It is characterized by an inflammatory exudate that forms a grayish or green membrane in the upper respiratory tract. This can cause acute severe respiratory obstruction. So this is a picture of pharyngeal diphtheria. Life-threatening complications from diphtheria include myocarditis and neuritis, usually affecting the motor nerves. The case fatality rate in the past 3 decades has been up to 16%. Antibiotic and antitoxin are the main treatments for diphtheria, but may not always be successful. Active immunization with diphtheria-containing vaccines is the only effective way to protect against diphtheria. So this is the end of this video. I hope it was helpful for you. Thank you so much for watching. Please subscribe, like this video, and share it with your friends. Thank you again for supporting me.